Well, good afternoon, everyone. Thanks for joining us again for our ongoing webinar series here in the Michigan Department of Labor and Economic Opportunity. My name is Sean Egan. I'm the Deputy Director for Labor. And as you all know, if you've been participating with us throughout all of the work we've been doing, this is part of our recurring webinar series where we talk about things that we can add to or are happening in our workplaces and how that impacts people's mental health and things that employers can think about and workers can think about and do in our workplaces to make them stronger. There's a Q&A box on your screen. You can submit questions at any time throughout the presentation. We will get to as many as we can at the end of the presentation. And don't forget to go to our resource hub where you'll find all of our previous webinars, as well as a sign up for our email. We do send out updates, not overly regularly because we don't want to flood your inbox, but we do like to get important information out that way. So please make sure you sign up for those. We are working on a few things behind the scenes that we hope to be sharing with everyone in the not too distant future, including some updates to the report we released about a year ago right now, and some of the data that goes along with it, and some other things we're trying to do to make sure we continue to move this ball forward the best that we can. We have a great webinar today. We're going to be joined by Jennifer Dillon, who is with the Michigan State Police, to talk about the work they're doing when we look at trauma that happens in our workplaces. So for many employers, you might think Michigan State Police, I'm not a law enforcement agency, we don't have trauma in our workplace. But let's get back to what trauma is. We use that word so much, sometimes it's hard to remember. It's because it's a big word and it covers a whole lot of things, what trauma actually is. And it's really just an emotional response to an event or a series of events. And if you followed along with this, you know, we talked a lot about brain science and how the stress response, once it activates, how we react. All of us wired the same way. Once that stress response activates, our logic center shuts down. We start having emotional responses to the situation in front of us. Our amygdala actually stores how we reacted to previous similar events and will respond in that type of fashion. And it can be lasting. And so when we talk about stress and chronic stress and all those kinds of things, that is a type of trauma that somebody's enduring, and that can come from a lot of places. But you can also have an event in any kind of workplace that's going to cause an emotional reaction and challenges for workers. As an example, just a couple of weeks ago in one of our construction zones on one of our highways, a worker was hit by a car and killed. Terrible tragedy for that person and their family. But every worker on that job site now has experienced that same trauma. So employers that are dealing with those types of situations are going to want to think about not only the response for that worker and the family, but the workers that are continuing to be on that job because they experienced it as well. And it can come in different forms. It can be in a workplace injury. It could be the loss of a coworker. It could be something happening in the workplace. I recently had a discussion with a union representative for a manufacturing facility in Michigan that had a worker that was locked in due to understaffing. A lot of employers are dealing with this. Locked in to work in 7 days a week, 12 hours a day for months. And then they finally got off that schedule for a brief period, and it looked like they were going to go back, and the worker ended up taking their own life. And they told their spouse that it was because they couldn't endure that anymore. So that's a tragedy in the workplace, and that was that chronic stress and trauma for that individual they're experiencing with no particular outlet that we're aware of. So we want to make sure we're having those types of discussions. And anytime that stress response activates, whether it's an event or a series of events, you're going to have that fight, flight, freeze, or fawn response that we've talked about before. We think about the story I just told you, that is the ultimate flight, avoiding that situation at all costs. Terrible outcome for that person and the family, definitely a terrible outcome for their coworkers. But that stress response is real. And there are ways that we can manage that. Now, there are certain workers we know, and the one we're talking to today, the Michigan State Police, firefighters, other law enforcement, healthcare workers, certain workplaces that might be a little more violent or more challenging, like Department of Corrections, where workers are going to be enduring chronic stress and potentially trauma throughout their working career. And we need to manage how we're going to respond to that to make sure that those workers stay healthy, that they can stay engaged, and that they can stay in our workplaces. So we're going to hear about a great program we learned more about recently. It's been in operation for quite some time, which is helpful. And we also want to make sure we tie that to anybody that's watching, a predominantly male workforce. We talked before about predominantly male workforces really struggling, and African American men in particular, with wanting to seek help. and the Michigan State Police have also dealt with that issue as well. So again, you can submit questions at any time. We'll do as many as we can, but for now, I'm going to turn it over to my new friend and our presenter today, Jennifer Dillon with the Michigan State Police.
Thank you, Sean. Can everyone hear me? We're good? All right. Well, thank you so much for that introduction. And yes, I agree with everything that you said. This is, yes, a culturally competent program here at the Michigan State Police, but really any of these programs can be put out for any type of workplace. So I think that this will be really relevant for all. So thanks for that. All right, so a little bit about our reorganization within the department. We have had many resources in place for a very long time, but as of July 2021, we had a new bureau developed or created, which was called the Professional Development Bureau. So the PDB, as we like to call it. It was created to really in recognition of the need to invest and support in this career-long learning of all of our members. So our department has approximately 3,000 members, a bit more, and about 1,200 of those members are civilians. So we have this growing reliance on civilian membership because all of the tasks that the troopers are being asked to perform are becoming much more complex. I myself come from 17 years serving in the Forensic Science Division. So my background in history is as a civilian, but working in crime scene. So yes, traumatic content was part of my lifestyle. So we really recognized this need to focus on the training and development of all of the members in this department. So it included a reorganization, but really most importantly for me and my close workers is the creation of 3 brand new sections. So we created the Wellness and Resiliency Section, which I, of course, will talk mostly about today, but we also created a civilian career development section and a leadership development section. And this was really important because, again, as you'll hear me state about wellness resources and programs, we had certain leadership programs in place, but no one was really in charge per se of coordinating, strategically coordinating all of this programming. And civilians, again, were sometimes, I hate to say left out, but as a civilian, I used to say that. So I know that that's sometimes how you felt being in support of the troopers, right? So we wanted to definitely change that. And we know that career development for civilians might look very different than professional development for our enforcement members. So with these 3 new sections, I was just even saying it earlier today with some of my colleagues, we cannot talk about one without the other because we so strongly feel that wellness and resiliency, professional development, leadership and development, they all go hand in hand. So we're thrilled that we can pull our resources together. With regard to the Wellness and Resiliency section, our positions were filled in late 2021 and early 2022. So even though we've have programs that have been in place for a really long time, a strategic, coordinated training section really has not been in existence for very long. So the first step that my team and I wanted to put in place was really determine where are we as a department. So what's the baseline? Where are we at with regard to stress, burnout, all things wellness? Do you know what kind of programs we have and are you using them? And then once we got that information, we wanted to establish any programming to fill in any gaps. So we issued this survey in early 2022, and as you can see listed here, these are some of the programs that we already had in place. So we had a chaplain corps that was interacting with different enforcement members across the state. We've got employee resource groups. We had some websites. We've got some collaboration with Sequoia Financial Group. They have a great program called Guns and Hoses, which I love the name. Think that it's super creative, but as a civilian, I didn't think that I had access to some of that financial knowledge and education from them. As it turns out, I do. We all do. We have an Office of Behavioral Science, and so that's been around for decades. And as you can see, our department was very well aware of the resource. We didn't ask who was specifically using each of these. This was a question of whether or not you are actually aware. So we have our behavioral sciences, we have our peer support team, they work hand in hand. And then we also have wellness instructors. So physical fitness, especially in the state police and any policing field, physical fitness is of course focused upon quite predominantly when it comes to wellness programming. We really wanted to take a holistic approach to wellness in general. So any program that we create, we wanted to make sure that if you looked at the totality of our wellness programming, we would be filling in all of these roles. So, physical just really means, what are you eating? How much are you resting? And how much are you moving? But your mental wellness might really go back to a lot of core beliefs that we've had and held on to for a really long time that are controlling some of our thought patterns. And some of those thought patterns might be very constructive. Some of them might be a little destructive, right? We've got our emotional wellness, which is, how well can you identify and properly express some of the emotions that we feel on a daily basis? Social wellness might include your social support network, your family network, friends, your coworkers, but also your finances. And then finances and social is very, very tied together, right? And then spiritual wellness, we consider anything that allows you to connect with yourself and higher than yourself. And so there's usually a lot of defining that goes into that term spiritual, because sometimes people by default think that it means religion, but it really does not. It's the connection of anything higher. It could sometimes be discussed in a professional setting as ethics and morals. It could be a connection of what can I do to be of service, not only to myself, but my colleagues and to this community. And so in the law enforcement policing world, we speak to that regard a lot. But outside of this circle, you can see some of those stats. These are the results from the wellness survey. So as an example of the number of respondents, which, as I mentioned, 3,000 or so members in this department. This was a voluntary survey, and we received nearly 2,000 responses. So in the world of voluntary surveys, that is a really high return on investment when it comes to this survey. So it told me and my team that the table was set, that people were interested and wanted to have some input into the wellness programming, which I thought was really cool. So going back to these areas, 47% of our members stated that they would be interested in fitness and nutrition coaching. So we have a lot of members working in the department that, we have shift work. We might have a lot of sedentary work where, in an office setting, we might have folks that are working the road. And again, if it's during off hours, you may or may not have the time to break out a full meal and have a lunch break, right? And some of our troopers might be eating in their cars, for example. So 47% interested in some leadership in that realm. When we talked about the mental wellness practices that our members had, 23% were interested in some educational content. And I'll just kind of put mental and emotional together. They're actually two different things, but many people lump them together. And you can see by the percentages for emotional, 23% also interested in educational content. So I think people really just think of them being the same. But you can see also what's similar between these two is training for management. So I think that our members really felt as though they wanted to have not only training for themselves to learn some stress management skills, some emotional intelligence skills, but also some learning educational content for management. What is a trauma-informed approach to management? What does that look like? How can we encourage our members to speak to supervisory staff about, how to have the skills and the language to even ask for help? So we talk a lot about smashing the stigma of mental health. And I think that's where some of that is coming from. So how do we normalize the conversation? When we move on to the social aspect, here at the Michigan State Police a few years back, a lot of our troops were given the opportunity to take their vehicles home. And it created this sort of separation. They were no longer showing up at the posts in the morning and having, pre-shift briefs, and same thing was not happening at the end of a shift. And so there was a lot of social interaction that was lost in the department when we shifted to this system. There's lots and lots of benefits, but this is kind of one of the long-term effects that we're seeing now. And so a lot of our members are interested in more team building and social events. So you have to think about, if at any time you may end up needing to reach out to a colleague or a supervisor and ask for help, it's really important to first have that relationship established. So you're not like cold calling for help, right? So it is very important to have these team building and social events. And it's challenging, I think, to start building some of these into the framework of your social or work environment. If you have a toxic environment, you can't just say, we're having a barbecue, show up, because people don't want to come and hang out, right? So it's important that you're including these team working events in a positive way. And really, if the environment is toxic, it's a little too late to start that. So it's important that even if things sound and look great in your working environment now, you keep fostering that, keep nourishing that. One of our biggest numbers, you can see 58% were requesting financial education and resources. So I thought that was a really high number in comparison to a lot of the other resources that were being asked for. And when it came to spiritual wellness, many of our members expressed that it was just a preference to explore it individually. We did have definitions for each of these types of wellness in the survey, but there were some comments about religion again. And so I think that there's a lot of education that comes about when I talk about a spiritual wellness practice. I often say things like, that feeling you get when you stand at the edge of the Grand Canyon, or some other like natural phenomenon, and you realize I'm really just a small part of this world. And there's this connection to something much bigger, something that's been around a lot longer than myself. That's that feeling. We call it the feeling of awe. And there's a lot of scientific research on that feeling of awe and how that really nourishes us from a wellness practice standpoint. So I got from that there just needs to be some education and awareness on what that component of a wellness practice looks like. So really, we wanted to focus on resilience courses because we didn't have that in the past. So we definitely feel strongly that going back to that holistic approach, you're going to, in order to build resilience, you're going to need a wellness practice in each of those areas. So there's skills that we can train in each one of those areas to build an overall sense of resilience in a person. It's really about developing a consistent practice, daily behaviors that lift you up, that carry you forward, right? Because you can think of any stress you encounter as sort of taking money out of your bank account. And you can think of building and utilizing your skills as putting in a deposit, right? And so we just want to keep making daily deposits into our like wellness bank to make sure that we're feeling strong and resilient, right? That we're agile enough to handle any challenges or adversities that are going to come our way. So that's really the goal of any of this training, is to give lots of tools, because we've got lots of situations, and some skills might be really helpful in your home life. Some of them might be really helpful in the professional world. And so that's the way I think about my tools. It's like, I've got this big toolbox. What do I pull out for each specific need? So another way we can think about this is this term of staying left of bang. So in the center here, you can see this bang can be thought of as any type of traumatic event. And so it might be a critical incident. Like Sean was mentioning with those accidents in the workplace, it might be in the policing world, an officer-involved shooting. But it could also be a personal incident in your life. It could be a divorce. It could be a illness in the family, loss of a loved one, a sudden move, any change in circumstances that are going to sort of rock your world, right? And there's two ways that we can look at handling said situation. If we're proactive and we're being self-aware enough of what my level of resiliency is, and I can start to prepare and maybe even prevent some of these things from happening. If I'm being reactive only, then I'm just left with processing and respond and really reacting to the situation. So if you think about that money in your bank account, right? If we're being proactive, we're putting deposits into that bank account, and you can think of these critical incidents, the bang, as a major withdrawal. I want to make sure I've got enough money in the bank so that I don't go into the red when that withdrawal happens, right? So anything resilience related, anything wellness practice related is going to be building up that left side of bang. So here are just some examples, and these are some of the skills that we talk about in any of our courses. One of the real big ones for me is a gratitude practice, and there's lots of evidence-based research behind a gratitude practice and how it actually reframes your natural method of thinking. For survival reasons, our brains tend to skew toward the negative, right? And the more we practice gratitude, the more we start to build a bridge in another direction so that we don't always default to negative. So we have so many thoughts in a day, and like 80% of those thoughts are negative. We can actually do something about that by simply beginning a gratitude practice. So just one example of some of these proactive tools that you can use to start to build resilience. We do have a lot of resources in our department that would assist if you were on the right side of bang, right? So some of these symptoms might be things that someone is experiencing if they are reacting to a traumatic event. So definitely, some changes in attitude, changes in thought patterns, changes in sleep patterns, eating patterns, communication, things of that sort are going to be symptoms of, if you want to go back to that bank account theory, if you have overdrawn from your bank account, there's going to need to be some work done in order to move through some of these symptoms. And so for us in our department, this is where our Office of Behavioral Sciences really come into play. My section primarily focuses on that left side of bang, the proactive approach. But luckily, I've got wonderful colleagues, trained clinicians that can jump in and assist in these types of situations. Also, we have our peer team in place. And so our peer team members, if someone is not interested in going directly to our Office of Behavioral Sciences, they can reach out to a peer and sort of begin that process. Sometimes simply talking about something sort of removes that barrier and allows that member to recognize there is a need for help, and maybe they make that call. They can always use resources within our department or also outside of the department as well. This is kind of my brain map of where we'd like to go. So, looking at our wellness survey that we conducted a little over a year ago, these are some of the gaps that I saw within. And this is kind of where we've invested our time and our money since then, and where we will move towards so in the future. So I'll just kind of briefly run through some of these. You saw that there was a real need for the physical and nutritional kind of coaching component. So we here in the department already had wellness instructors spread across the state because we have a physical readiness test that we allow all of our members to take, but our enlisted members really need to be taking this test. And so the wellness instructors, the design there is to really assist in training for those tests and to support a physical fitness daily practice so that they're prepared for these tests, right? But we've So we're split up into 7 districts across the state. And so we took, within each district, we took one of our wellness instructors and gave them nutritional coaching certifications. And so we're actually just rolling out this program. So if anyone from MSP is watching this, we haven't officially advertised it quite yet, but it's been kind of been piloted throughout the state so far. So essentially a member would be able to get some one-on-one coaching that would last a certain length of time, short check-ins. Here's a meal prep plan. Go ahead and practice this, and then we'll check back in and we'll see how it's going for you. So we're really excited about that. We have invested in resiliency instructors, and we offer a 3-day resilience course. And we specifically chose to hold this. I don't know if anyone is familiar with the Ralph A. McMillan Center. It's like a rustic conference center up in Roscommon. And so that's, we're a statewide agency, and that is a good place for us to sort of meet somewhere in the middle and host these courses. It's 3 days to get away. We can sit by the campfire and debrief and talk about some of the skills that we learned, or just become, better friends. And it's been a really nice program. People have really enjoyed going to that. Our mindfulness program, we're still in the very beginning training phases. So I'm in a training program to support my certification to become a mindfulness facilitator. And we're also seeking out and beginning to train some mindfulness coaches. So the intent will be that we would also be able to offer a foundational mindfulness course. So it might be an 8-hour course, an introduction to mindfulness, and give you skills on how to incorporate mindfulness into your daily activities. And yeah, that might include a formal sitting practice in the morning, but it doesn't have to. It could just simply be learning to become more aware of your thought patterns, learning to become more aware of your emotions and how to really handle them. The financial aspect, I mentioned Guns and Hoses already. Voya, of course, is our retirement system, and they're always happy to do some educational content for us. But Smart Dollar, that's the Dave Ramsey program, and we're working to bring that to our members currently. That would give them a digital platform to work on, budgeting, debt reduction, savings. There's educational content, there's group coaching. So it will be a really great product. We're trying to, it's a heavy lift for us right now to get that out to our membership, but we're going to be really happy when we get that. And then finally, our family support. So maybe this is specific to Michigan State Police, but we wanted to create a critical incident resource guide. And so I'll leave it to you to think about how you could do this in your own departments. But essentially, we have a lot of official, like administrative, I don't want to say orders. I can't think of the word I'm looking for, but plans in place for how to handle a critical incident administratively. Forms that need to be filled out, things that have to be boxes to be checked. But we didn't really have a program in place to think about the wellness of the employee and the employee's family, and also the coworkers. So if you go back to the example of the construction worker, this would be a manager in this position. Don't forget to think about the milestones, to think about the colleagues and friends that are involved, check in on them. And here are some things to remind you to do that along the way. So it's really a supportive guide for management. And then the last thing that we're putting into place is a family readiness group. And that is a program that we're looking to just get spouses involved, really, and to get some of that team building.
Jennifer, if I could, I think
Yes.
It's my fault. I let you go long because it's such good information, but we do have a fair number of questions. So
Yes,
if we could jump
this is
into
my
the
last
Q&A
slide.
period.
Yes, go ahead with the questions. I'm happy.
Yeah.
All right, with that, I'll take the first one that asks if the state has a resource for physical and nutritional wellness or any sort of mindfulness activities or education.
I'm sorry, just say that one more time for me.
Yes, resources for physical and nutritional wellness or mindfulness activities and education.
So resources, you're
Yeah.
asking for resources. Yeah.
Yeah, if state
So
has any available or others you'd like to know.
we don't have, like, I don't have a website that I can direct you to that is for Michigan State Police resources. I can lead you towards the mindfulness resources that I currently rely on are from UCLA MARC Center, which is Mindful Awareness Research Center. They have some workplace, it's called MAP, Mindful Awareness Practices, and they have courses that you can you could set up and have them done in your workplace, or just an individual member could choose to join. And I'm going through several of those programs myself right now, so I can attest that they're good. And then you said nutritional?
Yes, that was another one in there.
Nutritional, so our certification through our nutritional programming is precision nutritional. Level 1 certifications is what we've got.
And we do see, I have seen, Erica, for certainly we're seeing employee resource groups kind of pop up across the state of Michigan in different departments that are helpful for those types of things. There are some tools in the Learning Center that I've seen on mindfulness and some other things. Probably nothing on nutrition, at least that I've ever found, but there are some of those tools available. And then certainly through our EAP programs or other programs, there might be some tools available there too. I think one of the things that we're working toward and trying to do is we have this great program from the state police, and we don't see that universal, right? So we're kind of trying to push toward how do we get more global across the state of Michigan as an employer.
All right, and we didn't publish these, but there's a couple of questions that have a common theme related to stigma and using mental health services in the workplace or even outside of the workplace. And so from a state perspective and, maybe from the MSP program perspective, if either of you could share a little bit of information about how stigma plays a part in people seeking out these types of programs and services.
Well, I certainly would suggest that stigma does exist, and that the culture of, it's just part of your job, or suck it up, get thicker skin, that's prevalent in the policing profession for certain. And the best way, in my opinion, to change that is to start normalizing the conversations. And so we start in the Recruit Academy. We have an 8-hour curriculum for wellness, and I know Office of Behavioral Sciences also has 8 hours. So they're essentially getting 16 hours of this is what we expect, and it's talking about it. We're smashing the stigma right from the very beginning. And I know that that's a longer, more organic process, but it's a good place to start. I also think it's important that we show up. We show up in all of the different work sites, and we speak to people person to person and have these conversations.
I think that that's all we have time for today. I think if we want to close out, Sean, we did have a couple other comments that weren't necessarily questions, but about, the purpose of this event and handling trauma in the workplace outside of, say, you're a state employee or state police employee. So maybe just closing out with some remarks about how we hope this is sparking conversations elsewhere.
Yeah, absolutely. So one of the goals of today was to show you a program that's directly addressing these types of situations that happen in the workplace. I think for many of us in our lives, in our workplaces, we might not have these kind of tools available. So we want to get there. We want to get there where employers are thinking about the mental health and well-being of employees across the board. For an individual that's thinking about, like, something traumatic happened and I don't have anything at work, that's going to be a real challenge. All the way around. And certainly you're going to want to look outside your workplace potentially for any kind of support or tools that you might need. But our goal is to make sure that we know that the tools are available. We find ways to start incorporating them. I think the state police, because of the nature of their profession, have been doing this for quite a long time. Some new developments, as Jennifer shared, but they've been doing it for quite a long time, recognizing that this is going to happen on a recurring basis for these types of workers. I think what we're learning more as we continue to have this discussion and break the stigma is that it's happening for all workers. It might not be that type of event, but it's happening for all workers. So just that traumatic event in your workplace, first and foremost, is recognize that stress response activating, recognize that your logic center is not functioning the way that it normally would because the stress response is active, and start thinking about how you can shut that off so you can start processing the information that you saw. Again, another great presentation today. Thank you so much, Jennifer, for sharing the Michigan State Police's program on making a better workplace, a stronger workplace. And I appreciate everybody that's participated. This will be posted on our website as well as sent out in a follow-up email. And I hope you'll join us next month for our next discussion. I did see one question about race and how that particular piece in and of itself impacts people. I think if you're coming back in August, we're going to be talking about trauma more specifically and how adverse childhood experiences, racism, and other tools really impact the way people deal with stress. So I think there'll be some good information there. But thanks again for joining us, and I hope you learned something today.
Thank you.